and this will be the last webinar for this year. So we will see everyone next year. So for this today, our topic will be work-life balance in the HDU, high dependency unit. And we have our chairperson here today, Dr. Saiful Safwan. Dr. Saiful graduated from University of London with an MBBS degree in the year 2000 and obtained his MRCP in internal medicine from UK in 2007, and further went on for postgraduate training in advanced acute internal medicine, and currently is a senior consultant working in the Hospital Kuala Lumpur, and also he's the head for the CRC department in HKL and also Wind Focus provider. Without further ado, I will pass the floor to Dr. Saiful Safwan.
Thank you very much, Dr. Liu. Just a few corrections. I'm not a senior consultant. By definition, senior consultants are JUSA. I'm not. Okay, anyway, welcome everyone to the last webinar by College of Physicians Malaysia on the topic of acute internal medicine, and specifically Dr. Zulfa today, Dr. Siti Zulfa Zulkifli will today talk on work-life balance. And let me introduce Dr. Siti Zulfa. Dr. Siti Zulfa graduated from the UK. She attended Cardiff University, did medicine there. She worked for a few years in the UK and came back within a few years of graduating from the university. She obtained her MRCP and later on went on to obtain her subspecialty in acute internal medicine. She has been working in HDW, high dependency ward of Hospital Kuala Lumpur, specifically within the Department of Medicine for many, many years now. Yes, a lot of the capabilities of HDW has expanded from an 8-bedded HDW to a full HDW ward with about 25 bed strength. And correct me if I'm not mistaken, Dr. Zulfa later, that I think the ventilatory capacity approaches 16 beds, right?
Correct.
Yeah, okay. Now, Dr. Siti Zulfa has been the HDW consultant. For the moment, she is without a specialist. So as you can see, you can tell that she's a very highly capable individual. She has developed the Code Blue training in Department of Medicine since it started many, many years ago. She actually also created the obesity clinic within the department. She's the physician in charge of the UKM COVID hospital. She actually went on to be the physician in charge of MAEPS 3.0, but it never got off because we were at the end of the pandemic back then. And we wonder why the topic of work-life balance. As you can see, she's, well, I won't divulge her age, although I know she looks youthful due to the work-life balance that she practiced. She, you know that she's fit, and she's also Insta famous. So how does one get to that level, Dr. Siti Zulfa?
Oh my goodness.
So please, you have the floor.
Okay, thank you very, very much, Dr. Saiful. I have to say, I hope I can live up to that introduction that you gave me. But I have to confess, I am no expert on the topic of work-life balance. But what I'm trying to do here today is just to share with you what I think what I think of about work-life balance. Before I begin, I would also like to thank the College of Physicians for inviting me today to give this talk. Okay, my topic will be work-life balance. So not specifically to work-life balance in HDU, but work-life balance in general. So the term work-life balance was first used in the 1970s and 1980s, and it was used to describe that concept of achieving balance between career, family, and other areas of our lives. Now, the term balance here is not clearly defined, and it's open for interpretation. More often than not, it is defined as the number of hours we spend on work versus our personal life. And given the imbalance of hours we spend on these two elements that make up our lives, the concept of work-life balance seems almost impossible to achieve if you think about it. Now, whenever we talk about the concept of work-life balance, often we will visualize this traditional image of a scale with work on one end and life on the other end. So this picture actually creates a sense of competition between the two elements. But by right, work-life balance is not about spending 50% of your time at work and 50% of your time at home. It is how we allocate our mental, emotional, and physical resources to correspond to our personal and professional goals. We all have our own personal goals, professional goals. So we try to harmonize them all with our mental, emotional, and physical resources so that they become what we say integrated. Now, often the pursuit of work-life balance feels like a race to some of us without a finishing line. If you keep chasing one element on the scale, for example, if you keep chasing work, the scale will tip over towards one side, compromising the other element of your life. So, rather than they use the term balance, which will make the scale tip over in the photo here, because when you use the term balance, it implies that work and life are in competition with each other, and that life only occurs when we are not at work, and vice versa. This also assumes that life is good and work is bad, which is not necessarily true. So instead of looking at them as two opposing elements, a better approach is to think of balance as the integration of the elements of people's lives. So there are many elements of our lives, not just our work. It's our career, our well-being, our health, community, home, and family. So integration implies managing both work and family or personal priorities simultaneously so that they can coexist in harmony. So why is this topic so important? Why is work-life integration important? Number one, first and foremost, if you find a work-life integration, if you're able to integrate your work and life, you will definitely reduce the amount of stress that you feel. Now, we know that over many of our physicians experience burnout at some point in your careers. According to a study on stress in healthcare, where 226 physicians who had encountered stress at work, they all self-reported 76 adverse patient care occurrences. So not only does stress in healthcare worker jeopardize patient safety, it may also have a negative impact on a person's social, mental, and physical well-being. So there was a study by University College of London published online on European Heart Journal in 2010 of more than 10,000 participants that stated that white-collar workers who worked 3 or more hours longer than they required had a 60% higher risk of heart-related problems than those who didn't work overtime. Now, in this meta-analysis of more than 740,000 subjects, although this meta-analysis only consists of observational data, it showed that there is a link between long working hours, which they define as more than 55 hours a week, and the onset of cardiovascular disease and an increased risk of stroke. So as much as we want to try to avoid stress, we need to understand that not all stress is bad. Now, if you look at this, this is the human function curve, which was developed by Dr. Peter Nixon. He was a British cardiologist. He's a British cardiologist, which he developed this in 1979. Now, this diagram, if you look at that, it illustrates the balance of good and bad stress and how good and bad stress affects our performance or our productivity. So Dr. Nixon used this graph to show his patients the stages of health, from a bored, inactive stage from the very beginning to a healthy tension level, and eventually to feeling exhausted, ill health, or burnt out. Now, this graph shows that some level of stress can improve your performance and productivity. So some level of stress is actually good for you. However, our performance has a peak, whereby any further stress beyond that peak will lead to exhaustion and eventually ill health. So how do you prevent this? You need to have good coping strategies so that you do not cross that hump from stress to distress. You can never completely remove stress from your lives, but you can build resilience to prevent going into distress. So there are many strategies to manage stress. So one of them here, which I will mention, is the 4 A's of stress management. Remember the word avoid, alter, adapt, and accept. Avoid meaning you avoid the stressor. You learn to say no. So if you know that if that stressor is there, you won't be able to manage, say no. Avoid people who stresses you out. Take control of your environment and manage your to-do list. Have a to-do list and manage it wisely. So having failed avoiding the stressor, you can also try to alter the stressor or alter the stress. How do you do that? You change the way you communicate or you operate. So if, for example, if something or someone is bothering you, communicate your concerns in an open and respectful way. Because if you don't voice your feelings, resentment will build and the stress level will increase. Now, so you must be willing to compromise. So having failed that, the next step is you can try to adapt to the stress or adapt to the stressor. If you can't change the stressor, change yourself, you adapt. So change your expectations or change your attitude even to adapt to the stressor. And finally, if all three fails, you must try to learn to accept. Accept that some things are beyond your control. So you don't try to control the uncontrollable. You'll be under a lot of stress trying to control something that is beyond your control. You must also learn to forgive and look at the positive side. So there are always opportunities for personal growth, even though the future looks bleak or the stressor is causing you to obliterate your future vision. There is always opportunities for personal growth if you look for it. So number 2 is why work-life integration is important is because it will encourage living mindfully or mindfulness, practice mindfulness. When I say mindfulness, if you look at the picture here, it doesn't mean mindful of thoughts or full of ideas or full of emotions. It's just your mind being at peace. So when your work and life are integrated, you will develop greater control over your focus and your ability to concentrate on the task at hand. So being mindful is when you focus on being aware of what you're sensing and feeling in the moment. So in other words, living in the present. Don't start thinking, oh, why did I do that? Why did I do this? Or I should have done this, I should have done that. No, just live in the present moment and enjoy your life. For example, another example is if you're eating your favorite food, take the time to smell, taste, and enjoy your food. Don't just eat without any feelings or any emotions that comes with it, eating. So just live in the moment, enjoy the moment. So number 3, why is it important? Because if you manage to achieve work-life integration or you look for work-life integration, you will feel that there is greater flexibility to your schedule. So instead of separating work and life, so that means instead of looking at work as something in competition with your life, you don't separate work and life. Responsibilities can get done when they need to, according to the schedule that fits you. So when you have the flexibility to meet your personal obligations without sacrificing work commitments, you are more likely to experience greater job satisfaction and overall well-being. So am I talking rubbish? What do I mean by that? So examples. I know some of us, I've heard of some even doctors, medical officers, you actually go out and pick up your children from school during lunch break. That's fine. So that is sort of a form of work-life integration. So while at work, during your break, you pick up your children from school. So that's an example. Another example is, which I myself have always done, is working from the airport while waiting to board a flight for a trip. I'm sure many of us have done this. So this is when you're at the airport, like say for you waiting to board a flight for your own personal your holidays, and then you just remember, oh, there's something that I need to do. It's really important. So advancement in technology has allowed us to do some work anywhere. We can work anywhere with the advent of technology. So this is also another form of work-life integration. So another example is taking a break to exercise or go for a walk during lunch break. I know for some of you, you may think, oh, what am I talking about? What is she talking about? This is impossible. But to be truthful to you, it is not absolutely impossible. I've done this before. If there is a gym right across where you work, you can always go for like a workout for half an hour, then have a quick shower and then a quick sandwich for lunch, and then carry on with your work after that. So it only takes about an hour. So this is another form of work-life integration. So at another example of work-life integration, now some of you may have had experience working from home, but most of us probably have not experienced this because of the nature of our job. So this may not be possible, but if it was, then this is also another form of work-life integration where you can work from home while caring for your children or for a loved ones that are ill. So look at this diagram. Work is just one piece of a puzzle. So your work is actually your passport to your professional success and financial security. So although work is important, we all know that work is important. We accept that it is important, but it is even more important not to let work become the superset that dominates and overshadows everything else in your life. So if we let work dominate our time and our mind, we risk neglecting other critical areas that contribute to a fulfilling life, such as relationships, health, personal growth, family, so etc., etc., etc. So work should be a subset of life, not a superset. So our life, all of us, is a collection of various components that make it whole. So if your life is only consumed with work, then your life is not whole. Life is made up of many different components, and striking a balance, or more appropriately, trying to integrate them is key to achieving long-term happiness and success. Now, while we spend a significant portion of our time at work or thinking about work, it's crucial to recognize that work shouldn't be the only defining factor for success and happiness. Remember that work is a means to an end, not the end itself. It provides us with the resources and opportunities to enjoy and enhance other areas of our lives. So if we do not have work, it may affect our lives because we need work to live our life. Yeah. Okay, now how can we achieve work-life integration? Number one, find your purpose. Now, if you haven't found one, search hard for it. It is very important. And once you have found it, don't ever lose sight of it. Because when you lose sight of your purpose, you will lose your passion for or satisfaction with your work. Now, if this happens, keep reminding yourself or do things that will remind you of your why. Okay. So if all fails, if you still do not know why your purpose, ask yourself these three questions. Number one, what is important to you and why? Now, think about that. Number two, what are you good at? Now, think about that. And then you go on to your third question. How could the world be improved? In other words, what role can you play to make the world a better place? Now, think about all those three questions. Once you have the answer to all these three questions, try to visualize your answers. How do they overlap? Okay, what I mean is, maybe the next diagram will explain myself better. Now, look at this diagram, this picture. Now, you'll be able to visualize the answer to those questions better probably better using this diagram. So think about something that you love, figure out something that you are good at, and then figure out something that the world needs. And it will be an added bonus if you are also paid for doing this, where all these three things intersect. So if one effort isn't the perfect fit, it's okay. Try another. It is never too late to make a discovery in your pursuit for fulfillment. Now, you need to find your why, and you'll find your way. Your why is personal to you. No single person in this world can tell you what your why is. No, your why is personal to you and may change with time and experience. As a child, your why to become a doctor, for example, may be just simply to earn a good living. Simple mind of a child. Or just could be to climb up the social ladder because for some reason, people look up to doctors. Or it could just be to help others and be the caretakers of humanity. Now, knowing and remembering your why will help you persevere through your obstacles in life. Now, remember that happiness comes from what we do, but fulfillment comes from why we do it. And work-life integration allows your work and personal life to blend and coexist for you to be able to feel the sense of fulfillment. Now, next, number 2, how to achieve work-life integration is effective time management. Effective time management will allow you to make the most of your day, accomplishing tasks more quickly and prioritizing those that will have the most impact. There are many different time management strategies out there. Many have been described in books, journals, and it's important to figure out one that suits you. So a particular type of time management may suit you and may not suit another person, may not suit your friend. For example, a student may choose to manage his time differently than a working mom or a single father, because all these people have different goals, different personal and professional goals. So your time management method will differ. Well, some of you may know who this is. Would you like to hazard a guess? Some may be familiar with him, some may not. I will introduce this guy. His name is Dwight Eisenhower. Familiar? Okay, he was the 34th President of the United States. Before becoming the President of the United States of America in 1953, Dwight Eisenhower served in the US Army as an Allied Forces commander during World War II. Now, because he was the boss, the Allied Forces commander during World War II, he was faced with numerous difficult decisions that he had to make on a daily basis. Because of this struggle to aid in his decision-making, he invented a time management method called using the urgent important matrix, or what is now known as the Eisenhower Matrix. It looks like this. This is the Eisenhower Matrix. So what you do is when you have a list of your to-do list, so you've got a long list of to-dos for the day. Now you look at your list and put them under urgent or not urgent, important or not important. So the ones who the tasks that are urgent and important will fall into the category of do. That means you have to do it now. The ones that are not urgent, but they are important, goes into the category decide. So you have to decide when you want to do it, by when you have to complete that task. Now for the urgent but not important, you can choose to delegate. So they are urgent, but they're not so important. So you would have people under you working for you, so you can choose to delegate according to the expertise of the people under you. So the ones that are not urgent and not important, you can disregard. Or you can do it whenever you have a free time to do it, but they're not important and they will not have a big impact on you. So you can discard. So this is one way of managing your time. So I'm going to go through several methods of time management that have been used. Now, this next gentleman, I think most of you will know who he is. So this is Elon Musk. Now, Elon Musk uses the time blocking method. Now, time blocking method is just simply breaking your day into time slots and assigning specific tasks in each slot. Now, when you do this manually, this is how time management, the time blocking method will look like in your journal or in your diary or in your time management schedule, whatever you call it. But with the advent of technology, it can look like this. You can do this time blocking method using your phone, your computer, and it can look like this. So other time management methods are the Pareto principle or Pareto analysis. I just go quickly through some of them. This is based on the principle that 80% of outcome is a result of 20% of your effort. So this is the 80-20 rule. So whatever effort you put in effort on the task that will have the highest impact for you in the immediate future. So this is the Pareto analysis. The next is the Pomodoro technique, which is a technique uses a timer to break down your work into intervals. So you've got your tasks, you break them down into intervals, and you work strictly within those intervals. So when the time runs out, you take a short break, and then you do like 4 cycles, and then you should have completed the task within that cycle. Now, the next is the Parkinson's law, or it's not a method, but it is a time management method based on the Parkinson's law. So what Parkinson's law says is that work will expand to fill the time that you have allotted for its completion. For example, say you have something that you need to complete. Then you tell yourself, okay, I'm going to do it within the next, you've got 4 weeks to do it, but you tell yourself, okay, I'm going to do it within only 2 weeks, but you know you've got 4 weeks. So sometimes the thought of having 4 weeks, although you tell yourself you're going to use only 2 weeks, for some reason, you will slowly expand the time spent you doing that task, because you know you still have time. So for some people, especially for procrastinator, is sometimes they work better when closer to the deadline. So you know that, okay, I know that this task will take me about 2 weeks to complete. So now it's 2 weeks, it's 6 weeks away. So they choose not to start doing that. They will start 2 weeks before the deadline because they know they can work within that time. So this is actually a time management method that is suitable for some, but may not be suitable for all. So this is another method, is a getting things done method. So you capture, clarify, organize, reflect, and then you engage. Won't go into detail. I'll just speak a little bit more on this pickle jar theory because it's really simple and it's really very easy to understand. So you just imagine pickle jar, and you've got sand, you've got pebble, and you've got stones in the pickle jar. So imagine the sand is the interference, the noise in your life. The pebbles, the smaller stones like pebbles, so they are tasks that are important but not urgent. So the big rocks or the stones, they are important and they are urgent. So you want to try to deal with the rocks first, then you come to the pebbles, and the interference, the sand, you can just do without, you can just ignore them. Now, next, prioritizations. So people who can focus and get things done, people who can focus can get things done, but people who can prioritize get the right things done. And this is what you want. You want to do the right things. You don't want to have like a whole list of to-dos and trying to do everything, but some of the things that are on your to-do list are not important. So you have to prioritize. Do what's important first. Do what will have the most impact on you first. And then if you have time, you can do the rest. So the next, why is it important? How to achieve work-life integration is one of the things how to achieve that is to reset your mind. Almost everything will work again if you just unplug it for a few minutes, including yourself, which means that you just take time off for a few minutes, few weeks, or not too long, few days, few weeks, and then it will just start to work again and to work much better than before. So how do you reset your mind? One is self-reflection. Now, as a doctor, we are all making a difference in the lives of others every day, but we sometimes forget this. So if you can, every day, take a moment to reflect on the value of your work and how it contributes to the well-being of your patients and community. When you do this, it can help create a sense of fulfillment and satisfaction in your career. An example of how you can do this is by journaling. So you write down in a sentence each day of the good things that you have done and the little things that brought joy to you on that day. Writing down your experience will give deeper meaning to them and allows you to reflect on them more meaningfully. Now, next, how you can reset your mind is to practice gratitude. Notice the good things, express gratitude, do an act of kindness. Now, instead of saying to yourself, I have to go to work, because when you say that, you say, oh, I have to go to work today. No, don't say I have to go to work. Say, I get to go to work today. They carry almost the same meaning, but saying I get to gives you a sense of gratitude for being given the privilege of being able to go to work. Some people do not even have a job, so it will make us feel more grateful for what we have. Next is taking time off. When I say take time off, this can be short holidays away from work or short time offs throughout the day. Now, be it at work or during your personal time. Sometimes the secret to being more productive or getting more work done is simply by taking some time off to reset your mind. You will function better after resetting your mind, and you will become more productive after resetting your mind. Another way of doing it is to make sure that you get enough sleep. Now, taking a 20 to 90-minute nap in older adults has its benefits. Scientists have found that those who take short afternoon naps had better word recall. However, according to a study published in Journal of American Geriatric Society, any naps longer than an hour and a half or longer than 90 minutes will create problems with cognition and the ability to think and form memories. So if you do decide to take naps, make sure that it's no longer than 90 minutes. The best kind of nap are power naps, which you take for about 15 to 20 minutes. Usually people take it in the afternoon because this will enhance both your physical and cognitive performance, and it is an easy way to relax and reduce mental fatigue. Okay, finally, I'm coming to the end of my presentation. Before I end, I would like to share this narrative, which was published in The Oncologist in 2022. This is the author here. It is titled Work-Life Balance versus Work-Life Integration. It is a young physician mother's journey. So in this paper, the author described her experience managing both a career in medical field and responsibilities of a new mother. So she recently gave birth to a child, baby. So she described the joys and the challenges of the dual roles that she played. She is a hemato-oncology trainee at that time and also a new mother. And she also, in this article, offers advice to current and future mothers who are physicians in training. So a nice read. So I would recommend you, when you have the time, just to read through her experience and what she thinks about work-life balance and work-life integration. So her take-home message was, number one, you are worthy and valued. So do not ever forget that. Number two, be your biggest cheerleader and advocate. No one else is going to be cheering for you. So just trust yourself, believe in yourself, cheer for yourself. Number three, give yourself grace and do not feel shame in your dual roles. Don't be embarrassed to say that, yeah, you're a mother, you need to do this, you need to do that. Don't. So number four, support as much as you can others who are going through the same things as you are. Share the happy and the challenging moments. Sharing experience will help other people going through the same difficulties that you are. Number five, she was a new mother. So she's telling every new mother, love your baby. You will always be replaceable at work, but never, never, never at home. So remember that, very important. Now that brings us to the end of my presentation. I would like to share this quote by Dr. Andreas Schwingshackle. He is a critical care pediatrician who has spoken quite a bit on work-life balance and work-life integration. So Dr. Andrea said that the dichotomy between work and life leads us down a self-destructive path filled with frustration and disappointment. But in contrast, integration creates a positive and constructive attitude towards both of these entities. The concept of work-life integration acknowledges there is no perfect balance to be achieved between work and life. However, we can achieve a near perfect balance by accomplishing some work tasks at home and tending to some life responsibilities while at work, or in other terms, work-life integration. Modern technologies such as smartphones will facilitate much of this integration and can help foster healthy work-life integration. That's it. Thank you.
Dr. Saiful, I think your mic is still not on.
Yeah, sorry about that. Thank you very much, Dr. Siti Zulfa, for that very refreshing talk, which I personally I thought it was awesome. I think it should be a prescription for all new house officers and medical officers alike, and even specialists, really. Now, whilst waiting for questions from the floor, from the audience, um, simple questions. So, Dr. Siti Zulfa, what's your why and what's your what?
My why and my what is personal to me. Okay, my why and my what. Okay. Like I said, your why and your what, or it will change with time. So at some point in the past, when I was a student, my why and my what is there was at one point in my life when I was doing my membership exam. I told myself that no, I had to work hard to pass as soon as possible because I do not want to grow up one day. This was my why. My children they were my whys. I didn't want to grow up. I didn't want to grow old, uh, and tell my children that your mom failed her specialist exam. So that was my why. Actually, I didn't want to say that, so I had to pass. So, so everyone has their own motivating factor, their whys, but that was mine. But it changes because once I pass, then I would have a different goal. I would have a different vision, and it will change, and so will yours.
Right. So, throughout your talk, you were talking about all these strategies, uh, and basically talking. You were touching on work-life balance and integration. So, would you say this is only for uh, workers with specific or a lot of roles in an organization, for example, his of service, or do you think it's applicable even to any MOs, any medical officers, any specialists, any house officers? What do you think?
Actually, work-life balance. Okay, I will just talk a little bit more about work-life balance and why the concept now is work-life integration. It's the generational shift. That's why work-life balance, the term was started to be used in 1970s, 1980s. So that generation at that time, they had different experience, different expectation. So and then as we evolve, as the generation evolve, they undergo different experience, they had different opportunities. So work-life balance doesn't work for them anymore. It doesn't suit them. So people have changed the concept to work-life integration. Um, and this work-life integration, it applies to everyone, even with it doesn't have to it doesn't mean that, oh, it only applies to people who play multiple roles. No, it's important for everyone because ultimately all of us are looking for life fulfillment. And to get that life fulfillment, if you are able to integrate work and life, you will be feel more fulfilled in life. It's for everyone.
We don't have any questions for the moment, so just let me ask you one last question from me. So you touched on several techniques of time management. Would
Mm-hmm.
you say those techniques are to be used in isolation, or depending on situations, and you change them around to whatever suits you the best at that particular point of time or situation?
Oh, definitely you change them around. Actually, some of those time management methods are more suitable to certain specific type of individuals. If you know, I mentioned like one I mentioned some that is more suitable. I think the Parkinson's law I said the one with where the work will expand to fill in the time that you've allowed to complete it. So that time management method is probably more suitable for someone who likes to procrastinate. But but having said that, you also have to be a very disciplined person. So that means you set that time. You have to complete that task within that time. It that you will complete that task within that time if you're disciplined. So discipline plays a role as well. So and some of those time management method are more suitable for people who are in the like managers, people who manage a big organization. Um, for example, the time management method by someone who is very busy and has got a lot of tasks that he needs to manage in a day, and he needs to manage them within a very limited time slot, and if possible within that same day or within the next few days. Like the time blocking method by Elon Musk, what Elon Musk uses. So it's more suitable for that kind of situation, for that kind of person, or that person who plays that role. Yeah, so actually, if you read more about time management method, it will explain what kind of time management method that is suitable for what type of individual. So if you know yourself, how you behave, how you treat, how you organize your life, you will know which time management method will be most suitable for you. Mm.
Right. Right. I think Dr. Siti Zulfa has touched on her next, the second part of her talk in future that I will propose, identifying what sort of individuals you are at the workplace. Um, so far, there are no questions, audience. I think everyone's flabbergasted and still in awe to the new information. So, may I pass back the platform back to Dr. Liu?
Right, sure. Okay, I think we can conclude our session for today. This will be the last webinar for this year. We'll see everyone back January next year. We're starting with gastro for the January next year, 2024. All right, I think thank you everyone. Thank you, Dr. Saiful, Dr. Sito. Thank you.
Thank you.
Okay, bye. Thank you, Dr. Liu.
Bye.
Bye.